video is on the herpes introduction, types, symptoms, causes, treatment, medication, and prevention. Sometimes person have sores or blisters in or around the mouth or genitals, as well as other symptoms. These may have due to herpes. Herpes results from infection with the herpes simplex virus, HSV. There are two types of herpes simplex virus, HSV1, this causes oral herpes, which usually affects the mouth and surrounding skin. HSV2, this causes genital herpes, which is usually sexually transmitted. It affects genital parts and surrounding skin. If a person has an HSV infection, they will have it for the rest of their life, though some people never develop symptoms. If symptoms occur, they reflect the type of HSV. There is no cure for herpes, but treatment can help manage symptoms and reduce the likelihood of them recurring. HSV is a common virus. According to the World Health Organization, WHO, around 67% of people, globally, have an HSV1 infection, and 11% have an HSV2 infection. People may first experience tingling, itching, or burning, then notice sores or blisters forming around the mouth or genitals in the herpes infection. Symptoms tend to develop 2 to 20 days after exposure to the virus. Symptoms of oral or HSV1 herpes. Oral herpes causes blisters, people know it sometimes as fever sores or cold sores, to develop in or around the lips and mouth. Sometimes these blisters form elsewhere on the face or on the tongue, and more rarely on other areas of skin. The sores usually last 2 to 3 weeks at a time. When a person first develops the infection, alongside sores or blisters, herpes may cause pain and itching, swollen lymph nodes, fever, fatigue, and a general feeling of being unwell. Research suggests that around 33% of people with oral herpes experience recurring symptoms. During each recurrence, symptoms of oral herpes tend to last 8 to 10 days, according to the doctors. Symptoms of genital or HSV2 herpes. These sores tend to develop on the penis, around or inside the vagina, on the buttocks, or on the anus, though they can form on other areas of skin. Herpes can also cause pain when urinating and changes in vaginal discharge. The first time a person develops the sores, they may last 2 to 6 weeks. Soon after this initial outbreak, symptoms may recur frequently. Over time, outbreaks may occur less often and the symptoms tend to become less severe. 50% of those with genital herpes experience recurring symptoms. Symptoms of a genital herpes recurrence last 8 to 10 days, and there will be fewer sores than in the initial phase. During a recurrence, a person can pass on genital herpes for 2 to 5 days. HSV can easily pass from person to person through contact with the moist skin of the mouth and genitals, including the anus. The virus may also spread through contact with other areas of the skin and the eyes. A person cannot contract HSV by touching an object or a surface, such as a wash basin or towel. Having vaginal, oral or anal sex without using barrier protection, such as a condom. Sharing sex toys. Having any other oral or genital contact with a person who has herpes. The virus is most contagious between the time when symptoms first appear and when they heal. Less commonly, a person can transmit the virus when symptoms are not present. If a woman with genital herpes has sores while giving birth, the virus can pass on to the baby. There are some treatment options are available for both oral and genital herpes. Applying aloe vera gel to sores. Can take pain relief medications. Bathing in lightly salted water. Applying petroleum jelly to the affected areas. Wearing loose clothing to avoid irritation. Some people find that using ice packs help. Never apply ice directly to the skin, wrap it in a cloth first. No drug can get rid of the herpes virus. However, a doctor may prescribe an antiviral medication, such as acyclovir, to prevent the virus from multiplying. Taking these medications every day for longer periods can significantly reduce the risk of passing herpes to a partner, though it remains a possibility. The following prevention steps may reduce the risk of developing or passing on the herpes. Use barrier protection, such as condoms, while having physical relations. Avoid physical relation while symptoms are present. Avoid kissing and oral sex when there is a cold sore around the mouth or on the genital parts. Washing the hands after touching the affected area, during an outbreak. Thank you very much for watching the video.